Welcome to WheatSit's presentation, Nervous System. This is Dr. Regina Glenn, and I will be hosting this presentation. Two conditions that affect the nervous system are a CVA and a TIA. CVA stands for cerebral vascular accident and is commonly called a stroke. A CVA may be caused by an embolus, thrombosis, or another cause. A CVA causes neurological defects such as aphasia, hemiparesis, or dysphagia that last longer than 23 hours. These symptoms may continue following the acute event and may be considered to be residue or late effects of a CVA. A TIA stands for transient ischemic accident. A TIA causes neurological deficits that last under 24 hours and have no residue effects. Codes from the category G81, hemiplegia, hemiparesis, and subcategories G83.1, monoplasia of lower limb, G83.2, monoplasia of upper limb, and G83.3, monoplasia unspecified, identify whether the dominant or non-dominant side is affected. Should the affected side be documented but not specified as dominant or non-dominant, the classification system does not indicate a default. Code selection is as follows. For an ambidextrous patient, the default should be dominant. If the left side is affected, the default is non-dominant. And if the right side is affected, the default is dominant. Codes in category G89, pain not elsewhere classified, may be used in conjunction with codes from other categories and chapters to provide more detail about acute or chronic pain and neoplasm-related pain, unless otherwise indicated. If the pain is not specific as acute or chronic, post-thoracotomy, post-procedural, or neoplasm-related, do not assign codes from category G89. A code from category G89 should not be assigned if the underlying definite diagnosis is known, unless the reason for the encounter is pain control management and not management of the underlying condition. Codes from category G89 may be used in conjunction with codes that identify the site of the pain, including codes from Chapter 18. If the category G89 code provides additional information, for example, if the code describes the site of the pain but does not fully describe whether the pain is acute or chronic, then both codes should be assigned. Chronic pain is classified to subcategory G89.2. There is no time frame defining when pain becomes chronic. The provider's documentation should be used to guide use of these codes. Central pain system G89.0 and chronic pain syndrome G89.4 are different than the term chronic pain, and therefore codes should only be used when the provider has specifically documented this condition. Understanding the difference between epilepsy and seizures is important in coding. A seizure disorder is epilepsy. There are several different types of seizure disorders, including recurrent seizures, and may be with or without intractable epilepsy. This is the end of the presentation on nervous systems. If you have any questions, please contact your instructor.